Hi, I'm Dr. Kanniraj. I'm an orthopedic surgeon. I specialize in hip, knee, and shoulder surgery. Today, we are going to discuss about one of the most feared aspects of ACL reconstruction surgery. So, that is developing a post-operative infection. As we all know, even a small scratch or abrasion in the skin can get infected. Like that, in any surgery, there is a small risk of infection. Following ACL reconstruction surgery, the chances of infection is extremely low. It is less than 1%. So, we are going to discuss about this in this video. There are certain risk factors that increases the chances of getting an infection following an ACL reconstruction surgery. These risk factors include diabetes. When somebody has diabetes, their overall immunity level is little bit reduced, and then that increases their chances of getting an infection after any injury or surgery. Second, if somebody is taking steroid or other immunosuppressive medication for other medical conditions, that also slightly increases the chances of infection. The third thing is smoking or tobacco use. When somebody is a chronic smoker, or if they are using other forms of tobacco, that increases the chances of developing an infection following a ACL reconstruction surgery. Similarly, when the ACL reconstruction surgery is associated with other procedures like a longer duration surgery, like an additional meniscal repair or other ligament reconstruction, that also slightly increases the chances of this infection. So these are the risk factors of developing infection following a ACL reconstruction surgery: diabetes, smoking, steroid use, and then longer duration surgeries. Now, there are certain things that we can do to reduce the chances of this infection. So, how do we reduce the chances of developing an infection following ACL reconstruction surgery? Number one, whenever there is any open wound or healing wound present over the knee joint, we do not operate during that time. So, the skin over the knee should be dry, free from any abrasions or wound or any discharge when we go in for a ACL reconstruction surgery. In case if there is an abrasion or wound, we wait till the wound heals and it is completely dry, and then only we will plan for the surgery. Number two, we do not operate when there is active infection anywhere else in the body. For example, somebody has got a urinary tract infection or somebody has got a respiratory infection. In those case situations also, we wait till that infection is completely treated and cured, and only then we will go in for a surgery. Number three, during the surgery, we give something called as a prophylactic antibiotics. So at the time of surgery, before we start the surgery, after the anesthesia is given, you are usually given a dose of intravenous antibiotic. This prophylactic antibiotic reduces the chances of developing infection. This prophylactic antibiotic, another 2 doses are continued after the surgery also. So by giving prophylactic antibiotics, we reduce the chances of developing infection. The one important thing that we do to reduce infection in ACL reconstruction surgery is called as antibiotic soakage of the graft. What we do is, after we harvest the graft and we prepare it, we cover it or we wrap it in a gauze piece that has been soaked in a antibiotic solution. I use vancomycin. So what we do is, we take a piece of gauze piece and then we soak it in the vancomycin antibiotic solution, and then we use that gauze piece to cover the graft. So by doing this graft soakage of the graft, we are reducing the chances of infection significantly by tenfold. So vancomycin soakage of the graft reduces the risk of infection following ACL by tenfold. So these are the things that we do to reduce the chances of any infection following ACL reconstruction surgery. Now, what if by an unfortunate situation there is an infection? Most of the ACL infections are superficial. That means in more than 80% of the people who develop infection, that can be treated with a course of antibiotics, usually oral antibiotics, and with dressings of the wound. With that itself, most of the infections get cleared. In an extremely rare case, when there is an infection which is not cured by antibiotics, or the infection is persistent or present within the knee joint, then you might need additional procedure for clearing this infection. So in summary, following ACL reconstruction, infection is extremely rare. To reduce the chances of this infection, we will be giving you some antibiotics before and after surgery. We will be soaking the graft in antibiotic solution to reduce the risk of infection. So, by these measures, we are able to reduce the risk of infection following ACL surgery significantly.